Hello, please subscribe and like for our channel. Thanks very much.
Hello, so welcome to this new tutorial presented by the SchrDbb. So we're going to visualize the short cases. So you have an 18-year-old male that consults for a 1 week duration of left-sided chest pain, increasing by breathing and productive growth. This is a chest X-ray. So every time that you have a patient that presents with a chest pain that increases by breathing, that is called a pleuritic chest pain. Is it clear? It's called a pleuritic chest pain. And now, when you visualize this, you see that what is the abnormality that is shown. Is it clear? You can visualize a heterogeneous opacity located in the right lower lung field. We have a heterogeneous opacity located in the right lower lung field. Is it clear? So that is the answer. You can see a heterogeneous opacity in a right lower lung field. There is no shift or deviation of the trachea. The deviation of the trachea can be seen in pleural effusion. Is it clear? It can be seen in atelectasis. But in the case of a pleural effusion, the deviation of the trachea is going to be away from the affected side. While in the case of atelectasis, the deviation is going to be toward the affected side. Is it clear? In the case of pneumothorax, the deviation is going to be away from the affected side. So in this case, it is just a consolidation syndrome. Is it clear? So on this X-ray, you can visualize the consolidation syndrome, and the element is a heterogeneous opacity in the right lower lung field. Is it clear? That is what you see on the X-ray. Now, also, other element of the X-ray of a consolidation syndrome is that you can see an air bronchogram. Is it clear? Here you cannot actually very well distinguish an air bronchogram, but those are the elements of the consolidation syndrome. Now, the next thing, so your answer here is just a heterogeneous opacity located in the right lower lung field. The next thing is give 4 respiratory signs on the examination of the patient. So the consolidation syndrome signs of a patient, yes, we start from inspection, palpation, percussion, and auscultation. For the inspection, we are going to have a reduced H expansion on the affected site. Is it clear on the inspection? Is it clear? So that's one. The next thing is palpation. Palpation, you're going to have increased tactile firmitude on the affected side. Is it clear? In this case, the affected side is the right. So you have a reduced expansion on the right side. You have increased tactile firmitude on the right side. Is it clear? Now, the next thing after the tactile firmitude is percussion. Percussion is going to be dull on percussion. Is it clear? The next one is the case of auscultation. In case of auscultation, you're going to have the breath sounds are going to be bronchial breath sounds. Normally, the breath sound should be vesicular breath sound, but when you hear bronchial breath sounds, they are going vesicular breath sound, fine breath sound. Is it clear? You can just put your stethoscope and hear how it makes it making like a small blow, like. That's a vesicular breath sound. Now, bronchial breath sound is when you place your stethoscope at the level of your trachea. You're going to have to hear sounds which are harsh, like that, or bronchovesicular. Those are the different things that you have there. And then you can also have crackles or crepitations. Is it clear? So that is different from the signs of a pleural effusion syndrome. Is it clear? So now the next one is, what is your diagnosis? The diagnosis is pneumonia. And you need to know that there are 3 types of pneumonia. We have a bronchial pneumonia, we have a lobar pneumonia, and we have an interstitial pneumonia. In this case, it is all the lobe that is affected. So your diagnosis is going to be made basically lobar pneumonia, or some people like to say community-acquired pneumonia and all that. I don't like to say community-acquired pneumonia because I don't know if the patient has acquired it in the community or not. I just prefer to say what I am seeing on the chest X-ray. When you see on this HSA, you see that it's all the lobe that is affected. So it's a lobar pneumonia. When you see it is not all the lobe that is affected, but you see an air bronchogram, it means that it is a bronchial pneumonia. And lastly, when you see interstitial opacities, is it clear, or reticular opacities, it is much more of an interstitial pneumonia. So those are the different elements that you have to understand. Now, the nota bene is we have now other signs now of the contralateral part of the consolidation syndrome is a pleural effusion syndrome. So when they're asking what on physical examination, what are the elements of pleural effusion syndrome, what do you see? The first element of pleural effusion syndrome is what? You're going to visualize a reduced, on inspection, you have reduced expansion on the affected side. That's one. Second thing, on palpation, you have a reduced tactile fremitus instead for pleural effusion syndrome. You have reduced tactile fremitus. Is it clear? You have also on palpation, you have a deviation of the trachea away from the affected side. Is it clear? Now the next thing is on the percussion is going to be instead stony dull. So when you have stony dull, and then on auscultation you have a absent or reduced breath sound. Is it clear? All that tells you is a pleural effusion syndrome and not consolidation syndrome. So now those are the different elements that you have to know. So now continue with the next case.
Hello, purchase your book, medical book, health science book, physics book, computer science book, all from us on 652-659429, and please don't forget to like and subscribe for our two channels, Science Video Makers and SchrDbb. Let me say the number again: 65699429. That is a place where you're going to have all these books. As you can see, we have the computer science book, which is shown in this image. You can see this is all the example of the computer science book, all inside. You have all this. We have the medical book for the first year, second year, third year, all available with all the explanation and questions. We have the physical examination book with all the step-by-step physical examination. This is the workbook for medical third year. The workbook for medical third year. This is the first year workbook. This is the second year workbook. As you can see, this is the second year textbook. All this we have on the no contact 652-659429. Thanks very much.